Hi everyone, I'm Shane Luis Arguito, and today I'll be presenting two very important pediatric conditions that we often encounter in clinical practice: acute and chronic otitis media and cystic fibrosis. Both of these conditions can significantly affect a child's growth, development, and quality of life, so understanding them is essential, especially for us future nurses. Let's begin with otitis media. So, otitis media is the medical term for an infection or inflammation of the middle ear, which is the space just behind the eardrum. There are two main types. Acute otitis media is a sudden and often painful infection, while chronic otitis media is a long-lasting or recurring infection, which may come with persistent fluid or even a perforated eardrum. Etiology or causes. So the most common causes are bacterial infection, particularly Streptococcus pneumoniae and Haemophilus influenzae. It can also be triggered by viruses, especially after a cold, flu, or any upper respiratory tract infection. The infection travels from the nose or throat through the eustachian tube, which connects to the middle ear. So, incidence. Otitis media is very common in infants and toddlers. Studies show that about 80% of children will experience at least one episode by the age of 3. But the peak age of occurrence is between 6 months and 2 years old because their immune system are still developing and their eustachian tubes are shorter and more horizontal, making it easier for germs to enter the middle ear. There are three types. First is acute otitis media. This is sudden onset with signs like ear pain, fever, and irritability. 2 is otitis media with effusion. Fluid is present behind the eardrum but there is no infection. And 3 is a chronic otitis media, an infection that lasts longer than 3 months or keeps recurring, which can lead to complications like hearing loss. The risk factors are children are more at risk if they are well fed while lying down, exposed to cigarette smoke, attending daycare due to exposure to many kids and germs, have a family history of ear infection, or have allergies or frequent colds. Pathophysiology. The eustachian tube becomes swollen or blocked, usually due to infection. It traps fluid in middle ear. This creates pressure, pain, and a perfect environment for bacteria to grow. If not treated, it may lead to eardrum rupture, chronic infection, or hearing problems. The signs and symptoms. The child may show ear pain, often worse when lying down, fever, irritability or crying more than usual, tugging or pulling at the ears, trouble hearing, fluid or pus drainage if the eardrum ruptures. The diagnostic test, otoscopy, the doctor uses a special light to look at the eardrum, which may appear red or bulging. Tympanometry checks how the eardrum responds to changes in air pressure. Audiometry may be done for hearing assessment, especially in chronic cases. Medical management. First-line treatment is usually antibiotics such as amoxicillin. For pain and fever, acetaminophen or ibuprofen are commonly given. Decongestants or nasal sprays may be used if there's associated nasal congestion. And for the surgical management, for recurrent or chronic cases, the children may undergo a laryngotomy, where a small incision is made in the eardrum to drain fluid. Tympanostomy tubes may be inserted to help ventilate the middle ear and prevent fluid buildup. The nursing management. Our role includes assessing the child's pain level, fever and hearing, administering medications as prescribed, educating caregivers on the correct use of antibiotics, monitoring for signs of complications like hearing loss, and encouraging follow-up with an ENT specialist if necessary. Health teaching to parents: finish the full course of antibiotics. If tubes are present, keep the ears dry during baths. Avoid secondhand smoke exposure, and teach the parents to monitor for recurring symptoms and bring the child to the doctor if symptoms return. The part 2 is the cystic fibrosis. Cystic fibrosis, or CF, is a lifelong genetic disorder that primarily affects the lungs and digestive system. It causes the body to produce thick and sticky mucus that can block airways and ducts, leading to chronic lung infections and poor digestions. CF is caused by a mutation in the CFTR gene. These genes control how salt and water move in and out of cells. For a child to have CF, they must inherit 2 faulty genes, one from each parent. The incidence: CF is most common among Caucasians, affecting about 1 in every 3,000 live births. It's less common in Asian and African populations. Types: while there are no official types, the severity and symptoms can vary depending on a specific CFTR mutation that the child has. Some mutations cause more severe lung issues, while others might mostly affect digestions. The risk factors. The main risk factors is having 2 parents who carry the CF gene. Carriers don't usually show symptoms, but when both parents pass on the defective gene, the child can become born with CF. The pathophysiology. The mutated CFTR protein causes salt and water imbalance, which leads to the production of thick, sticky mucus. So this mucus clogs the airways, making breathing difficult, traps bacteria causing frequent lung infections, and blocks pancreatic enzymes, preventing proper digestion and nutrient absorption. The signs and symptoms. Children with CF may show chronic cough with thick sputum, wheezing or shortness of breath, frequent lung infections, failure to gain weight despite eating well, greasy or foul-smelling stools, and clubbing of fingers with toes in more advanced cases. Diagnostic tests. Sweat chloride tests measures the amount of salt in sweat, usually in high CF. Genetic testing confirms mutations in the CFTR gene. Chest X-ray and pulmonary function tests to assess lung damage, and the newborn screening is now routinely done in many countries, including the Philippines. The medical management. Bronchodilators like albuterol to open airways, mucolytics like Dornase alpha to thin the mucus, antibiotics to treat or prevent the lung infection, pancreatic enzyme replacements to help with digestion, and a high-calorie, high-protein diet to support growth and energy needs. The surgical management. In advanced cases, lung transplantation may be considered. Some children may need feeding tubes to maintain adequate nutrition if they can't eat enough orally. The nursing management. Nurses plays a vital role in supporting both the child and their family. We teach and assist with chest, physiotherapy, and breathing exercises, administer prescribed medications, monitor respiratory status and nutritional intake, and provide emotional support since CF can be a lifelong and emotionally draining condition. Coordinate with the healthcare team for a long-term care plan. Health teaching to parents. Teach the proper technique for airway clearance at home. Ensure the medications and enzymes are taken as scheduled. Emphasize infection prevention, including hand washing and vaccination, and encourage a nutritious diet and physical activity. Especially discuss the genetic counseling for future pregnancies and family planning. So that wraps up my presentation on acute and chronic otitis media and cystic fibrosis. I hope this gave you a clearer understanding of these conditions, from their causes and symptoms to the role of nurses in managing and educating the families. As a future nurses, our goal is not only to provide treatment, but also educate, support, and advocate for children and their families through the healthcare journey. Thank you so much for listening.